So thank you everybody for joining us. We're here to talk about our Support Paperless Initiative webinar. I'm Amy Leopold and I'm the Product Marketing Manager here at Florida Advantage. I'll be moderating today's webinar. Our presenters are Andrew Walk, Senior Client Services Specialist, and Melissa Taylor, Account Representative. We are lucky to have both of them here today and hope you enjoy their presentation. This is the third webinar in our summer coffee break series, and we are very excited with the response and feedback that we've had so far. Most of our customers are very eager for more information on how to maximize their current Florida Advantage products, as well as learn about additional solutions that we offer. Just a few items to note before we get started. There are a lot of people on the line, so your phones have been muted. We will be recording this session for future reference. If you do have any questions, please feel free to put them in the question panel, like a couple of you already had, to let us know about our audio difficulties. So if you have any other questions throughout the webinar, please feel free to put them in the question panel. Communication Director goes paperless. So we're here to talk about how we can help you with going paperless. Where is your organization in our paperless initiative? Many organizations have already started paperless initiatives, and by already replacing their paper records and filling up with electronic records. However, there are many other classes in the hospital that can be optimized to leverage electronic records and eliminate the need for paper. So no matter where your organization is on the spectrum of going paperless, and no matter your reasons for going paperless, maybe you want to be recognizing cost savings or improving efficiencies, decreasing errors associated with paper processes, or maybe you want to do any combination of all three of these things. Florida Advantage does have solutions to help complement your goals. So with that, I'll pass over our webinar to Melissa. Hello everybody, this is Melissa. A quick overview of the topics we'll be discussing today. First, we'll do a quick overview of what Communication Director looks like today. Then we'll discuss the paperless solutions we have to offer. And then we'll do an overview of some new functionality that we'll have coming out soon. So this is what Communication Director looks like today. As you can see, we do a lot more than just faxing. Today we'll talk about our paperless delivery options, which you can see on the right. We offer email, file drop, secure notification, HL7 delivery, and a few more. Many hospitals today are still sending and receiving reports and patient health information manually via fax or even the U.S. Postal Service. These processes use a large volume of supplies and resources. As you can see from Mark Beard's quote, they estimate saving at least 1 million sheets of paper a year in their lab alone. Forward Advantage's Communication Director product offers many solutions that can convert these costly and time-consuming processes into more efficient electronic and automated processes. So let's take a look at some of these solutions. One solution we have to offer to reduce paper is desktop fax. And then for those of you that aren't aware, desktop fax allows you to fax virtually any document from your desktop using Windows printing. This functionality works with a variety of health information systems. Even if you're faxing on demand from a system like Magic, you can still use desktop fax with any Windows application. Desktop fax is included with all of our Communication Director suite. This means you already own it, and that you can roll it out to as many people or departments as needed without having to worry about additional licensing costs. Here we show some of our paperless delivery modules. Two of the most popular paperless delivery options are email and file transfer. With email delivery, we use your existing email infrastructure to do things like send reports to your direct enrolled providers or notifications to your hands-free devices, such as the Vocera communication badges, and to smartphones. Using file transfer delivery, reports can be routed to network file locations, FTP or secure FTP servers. These delivery modules can be used with our Smart Route technology and or our inbound fax management module. Here we show what our how our Smart Route works. With Smart Routes, you can increase the productivity and efficiency of any department in your hospital. A Smart Route accepts reports from a host system and then automatically delivers that information in the method that you specify. Smart Routes require no user intervention, which is automating what was once a manual process. That saves you time and money for your organization. If you're interested in more information about Smart Routes, you can visit our website to view the recent webinar that we did, which focuses on Smart Route functionality and capability in greater detail. So from here, I'm going to go ahead and pass it over to Andrew Walk to discuss our remaining paperless functionality.
Thank you, Melissa. I'd like to talk about some of these options, and first one is inbound fax management, which delivers incoming faxes based on the number that the sender dials. These incoming faxes can be delivered via any of our delivery modules. Again, to avoid the paper delivery, you might consider the email or file transfer delivery modules. With inbound fax management, you're able to assign unique fax numbers to individuals as well as customize their delivery options. Aside from many of the solutions Communication Director offers to support a paperless environment, we also have another product called Data Express. Data Express provides bi-directional exchange of HL7 data with physician EMR applications. Clinical results flow seamlessly into physician EMRs from a variety of host applications. Physicians can submit orders to the HIS system directly from their EMRs as well. The outcome is an efficient and reliable, cost-effective, and completely paperless health information exchange. Coming soon, we have two new paperless options in the near future, the first of which is cold feed document processing. With this application, you'll be able to process inbound fax documents for eventual inclusion in the patient record via the Meditech ECM filer. The way this process is going to work is that we can receive with Communication Director an inbound fax that we will then save to a folder on the CDS server. With another application, Fax Filer, you'll be able to open those files, associate them with a patient record from the Meditech repository, and then save them to folders monitored by the Meditech ECM, thus allowing them to be included in patients' charts. We're also excited to announce a new integration between Communication Director and Imprivata Cortex called the Imprivata Cortex Connector. This API-level integration enables Communication Director's automated notifications sent from an EMR to be received securely on a mobile device via Cortex, a secure messaging platform. Unlike traditional SMS messages, Cortex messages are HIPAA compliant and will sync among multiple devices. The Cortex connector will be available in late summer. Feel free to contact your sales team if you want to receive more information about this product availability and features. Speaking of contact information, you can contact our support directly if you have technical questions at the addresses there. And if you are interested in pricing, you can contact our sales team at those addresses as well. So with that, I will hand it back to Amy.
Thank you so much, Melissa and Andrew. There was a lot of content that we covered there in a couple of minutes, and we do again apologize for the delay we had in getting started and with our sound. So hopefully everybody has been able to keep up with us through the webinar, and that hopefully we've generated some ideas about how Forward Advantage can help you replace any old paper processes that you've had. As mentioned, please reach out to us with any questions or anything that we can talk about that might specifically fit your needs of your facility. We do have a couple of minutes for questions. I see a couple of questions coming in now, so we'll go to those. And just as a reminder, we are recording this webinar today, so we will forward the webinar to you after it's closed, so you can share it with anybody or reference it again. All right, let's see here. Thank you, everybody, for those questions. All right, so the first question is going to be, you've mentioned desktop fax can be rolled out to anybody in your organization. We think we're already using it in the lab, but how do we roll it out to other departments? Andrew, do you want to take that one?
Certainly. You can roll it out very simply. There's a quick install of a driver that installs a printer, and it can be installed anywhere in the hospital. So there isn't any restriction on the number of desktops that it can be installed. So it's very simple to roll out to other departments.
Okay, and we have one other question here that is about Cortex, and it says, Cortex, you mentioned Cortex, is it the only texting application compatible with Communication Director? I'll go ahead and take that one. Yes, at the moment it is. We are exploring other options and would love to integrate with other secure texting and platform messaging applications. If you are already using one of those applications at your facility, please let us know, and we can talk about how we could integrate Communication Director with any other texting application. So always feel free to contact us with any needs that you have. And then one other question here, and we'll wrap up. You mentioned faxing directly from a document with desktop fax. Can you explain a little bit more about how that works?
I can certainly do that. Desktop fax appears to any application as a Windows printer. So when you're in the document or application, you simply print to that printer, and then it will open up our application and you'll be able to fax.
Okay, great. Thank you, Andrew, and thank you, Melissa. Again, this was great information today. We hope everybody was able to get some information that will help them. We're all out of time, though, and if we did not get to your question, though, we'll respond to it via email later today. But thank you, everybody. And again, we'll be sending you the link to the webinar as soon as it's done. Thank you so much for everybody's time, and we're looking forward to speaking with anybody who has any further questions or any details. And again, here is all of our contact information. Always feel free to reach out to us via email or phone. Thank you, everybody, and this concludes our webinar for today.